I love giving presentations. I realize that most people do not. And so I like to try to help you become more comfortable with giving a speech. Before we dive into anxiety, you should know this unit is going to teach you everything you need to know how to give a good presentation. We are going to look at how to select topics, how to research, how to organize our thoughts and ideas into an organized, structured format. We're going to learn how to have transitions and cite our research. We're going to learn how to use slides appropriately in our presentations and how to deliver our speeches. And when we work through those things, you do become more confident and better prepared. But in the meantime, if we don't understand anxiety, you will often feel very anxious about the speech during that process. And I don't want that. So I like to tackle this topic right up front. So you're more knowledgeable, you have a better understanding. Knowledge is powerful. We often fear the unknown. And so let's dive in to what it is in this video. In the second video, how we can manage it, the tools that we can use to reduce and minimize our anxiety. We do have a fear of public speaking. It is anxiety and fear, very, very similar, but it is very common. Did you know that most people would rather be in the casket than give the eulogy? That's based on polls when people are surveyed on how they feel about giving a speech. So, what do you need to know? One, you are not alone. Most people feel nervous before giving a presentation. It is normal, it is common, it is typical, and it is appropriate. We have the right and the beauty of freedom of speech, but we need to be appropriate and effective. We need to be ethical. We have a responsibility to make sure we are giving accurate information and treating the audience respectfully, and we will learn how to do that. So what happens? You find out you need to give a speech, and right from the onset, we start thinking, oh, I can't do this. Oh my gosh, I have to give a speech. I don't like giving speech. It's too scary. I'm not prepared. And all of these thoughts are triggering your anxiety. They're increasing your fear. I do love this acronym of FEAR, false expectations appearing real. Because a lot of times it's our imagination that gets carried away and not the reality of the situation that affects us. So what is the reality? The reality is you may have had some bad experiences in the past. You have not found success in giving speeches before. It could be for a lot of reasons. You might be feeling different and you're basing your fear on feelings. No one likes me. I'm terrible at this. No one's interested in me, which none of that is true, but that's how we're feeling, right? Or we don't like being the center of attention. Right? Oh no, they're looking at me. Well, that's a good thing. Eye contact. That's a good thing. That's a positive. But we feel like it's a negative. And when we have all these thoughts, what happens is our body responds and starts manifesting numerous symptoms. You know some of these symptoms, pick and choose which ones you have, right? Adrenaline's racing through your body, your heart rate is increasing, your stomach is churning, or butterflies in your stomach. You might have increased sweating or perspiration, dry mouth. These are all very common symptoms. We can learn how these appear and what is that underlying cause of these symptoms. Well, when we talk about speech anxiety, it really is stage fright, for the lack of a better word. And so, what you should know, there's basically two types of anxiety. There's the situational, which is based on the time, the place, the people, the public speaking, or the one-on-one, or it could be group communication that you find very anxious, right? That would be situational. Trait is more personality based. Or if you have some mental health issues with anxiety, that also would contribute to, would be trait. My daughter has 4 or 5 different types of anxiety, but she's actually able to give a presentation, and that doesn't really bother her. So just because you have anxiety in some circumstances doesn't mean it applies to all. So, what is speech anxiety all about? Well, really, it's performance anxiety. So, if you are a musician or an athlete or an actor or a dancer or a singer and you do any type of performance, this is the same type of feeling, right? If you're a musician and you're preparing for a concert, you may experience some anxiety prior to that. Or athletes, you might be nervous before playoffs or a competition, right? That is performance anxiety. This is not any different. So anything that you use for these areas of performing, you can also use for public speaking. But why is this happening to you? What's really going on in your body? So let's look at the more of the physiological response here. Your thinking actually leads to your feelings. So when you have more positive thinking, you have more positive feelings. If you have negative thinking, you're going to have more negative feelings. I can't do this, I don't like this. You're going to feel more negative, more anxious, more nervous, because your thoughts are triggering the feelings. So you're making it worse. We'll talk about that in our next video. But it's our thinking that leads to the feelings. It's a physiological response to the psychological state of mind. So here's your brain over here on the left, and what's happening, your prefrontal cortex, those of you who are young adults, is still developing. Not till about 25 or so is it fully developed. When you are developing that prefrontal cortex, it doesn't have the ability to distinguish all the time the little details of different scenarios. So when your brain perceives danger, your amygdala is saying, danger, danger, this is a warning, this is bad, you need to be alert. But because it's not fully developed, sometimes it can't differentiate between scary and non-dangerous and dangerous. Is giving a speech actually dangerous? Is anything going to happen to you? No. If somebody's breaking into your home, is that dangerous? Yes. Both are scary. So your brain doesn't always tell you the right information, right? And you have to tell your brain, I understand that you're scared. Thank you for the alert, but I understand this is not a dangerous situation. And when your brain is thinking that, then your body responds. You have increased adrenaline flowing through your system, and cortisol is your stress hormone, and those levels go up. Of course, when you have adrenaline flowing, you may have learned this in psychology, we tend to respond with the flight or flight response. And now they're adding in freezing as well. Well, let's look at that. If you would like to pass this class, you have to give both of the graded presentations. No questions asked. So fleeing, flying away, running away is not an option. Our only other option is to fight. You're going to learn more about your cortisol in a TED Talk video that you'll be watching in this week's folder by Amy Cuddy. And it's fascinating information. So all of these things are happening physiologically as a result of our thinking and our body's response. There are actually different types of anxiety. You can experience it during pre-preparation anxiety, we call it, right? As soon as you know. I have a few tips here. You can pause and jot those down if you'd like. There is preparation anxiety, not knowing where to start. You're overwhelmed. That's why I break it down. I'm going to tell you how to start. I'm going to tell you the process. Pre-performance anxiety might occur when you start rehearsing or practicing. You will feel awkward and uncomfortable, and that often triggers some anxiety. So that's pre-performance anxiety. And then finally, performance anxiety, that occurs when you're actually giving your speech, right? Right before you start speaking. We are fearful, and we want to act like we're confident, even if we don't feel like it. Right? We want to appear confident. So the next video is going to walk you through numerous tools that you can choose from to work on trying to relax and manage your nervousness.